of you to the Ask About Cancer initiative by Practo in association with HCG Healthcare Global Enterprise, HDFC Life and Logical India. In this session, we will provide answers to tons of questions you have asked us on cancer. Let us start today's session with the introduction of our first guest, Dr. B.S. Ajay Kumar, founder and chairman of HCG Healthcare Global Enterprises, a radiation oncologist who returned from the US to change the way cancer was perceived and treated in our country. His visionary zeal has helped establish 18 private cancer centers in India in a very short span of 8 years. Sir, can we have a few words from you?
Yeah, once again, thanks for having me here. And on this particular day, the important thing to think about cancer is today we talk about conquering cancer. The best way to conquer cancer is to see how we can control the disease. We may not be able to cure cancer all the time, even though we like to cure cancer. Important thing is, of course, prevention of cancer. We can't prevent all diseases for various reasons. And other next thing is, can we detect early? Obviously that gives us cure, but cancer is a very complex disease, so a lot of times we may not be able to detect early. But what is being doable today is to make it into a lifestyle chronic disease. So like we live today with diabetes or blood pressure, we can learn to live with cancer provided we go with the right approach from day one when the cancer diagnosis is made. So in my view, for a lot of times the fear of cancer is worse than cancer itself. So a lot of things what we try to do is to how to overcome the fear, have a positive approach towards cancer treatment and undergo the right treatment at the right time, which gives the right and obviously outcome. The most important thing in any cancer is understanding the disease and right approach to the treatment with a positive approach. Usually positive approach makes a big difference, and undergoing the right treatment, and with this you are bound to get good outcome, and continuous follow up and see what are the ways we can make sure we can keep this disease under control. That in a way is conquering cancer.
Thank you so much, doctor. Cancer is growing concern, but the right doctor and the right treatment, and most importantly, as doctor rightly pointed out, the attitude and the frame of mind, you can beat it. We have Vandana and Amar, two individuals who have successfully won their battle against cancer. Let's have a word with them. Vandana.
Hi, I'm Vandana here. I would like to share my experiences about my journey through cancer. This was about 7 years ago. I suddenly felt a little crab crawling into my body suddenly. It was not an ordinary crab. It was the crab associated with a big word C. Anyway, after all the investigations, it was found malignant. But why me? All of a sudden, I had led a very healthy life. Anyways, I had to come to terms with it. And then, with the support of my family, I underwent my chemo, my radiation, my surgery. And as you see, I'm fine here. 4th February, World Cancer Day, is a global observance that helps people raise their awareness against cancer. According to WHO, it is estimated that more than 85 million people around the globe are affected by cancer. To show the world that we can, or rather I can, have a fight against cancer and from victim to victory, I can tell you that a negative mind will never give you a positive life. Always have hope. Hope, that is, have only positive expectations. So stay healthy, stay strong, do your checkups, do your exercises, and let's spread the message. Let's make a world a better place for you and for me and the entire universe. So that with a smile on my face and a song in my heart, I shall say, cancer remains only as a zodiac sign. Thank you.
Thank you so much, Vandana. I'm sure the smile and the song would have put a smile on many faces today. Amar, let's hear your experience.
Yeah, hi everyone. My name is Amar Bhaskar. With 30 years of IT management experience, a professional in that field, was diagnosed for tongue cancer 10 years ago, 2006, and a recurrence in 2009. So I have gone through all the types of treatments that you have in cancer, starting from radiation, chemotherapy, brachytherapy, biotherapy, and then surgery, and then post that the chemocycles, and so on. All through the cycles, one of the things which I have always remained with the positivity thought that we bounce back and continued with all my work. Imagine I just took 2 weeks off from office only during the surgery time, and 1 week off while there was an intense brachytherapy radiation. That's it. All through was working through. In fact, let me quote one small incident. For the surgery, when I went to the hospital to get myself admitted, I had my father, 80-year-old, come along with me to admit me. We got into the room, and my father was reclining back at the where the caretakers normally sleep, and I was on the bed with my laptop with the email. After a while, the nurse came in and asked a doubt, "Sir, who is the patient?" So that's the zeal, you know. So I continued to work unperturbed, totally all through, and that was just the starting point. Continued to work with my professional bodies, all the social courses that I did, reinvented myself with a latent photography hobby, and started a group called Vismaya, Photography for Cause, giving away, donating away stunning pictures for people who donate for social cause. And we conduct exhibitions at Chitakala Parishad every year. Right? The exhibition is called Varshini, to shower that love and affection to all for the social cause. What I really mean to say is this experience that I have gone through is a life-changing experience. My outlook in life is very, very different today with all that I have gone through, and I want to help all others to succeed. So further, we have a Pink Hope support group to take other people, connect them together with all the other like-minded people who can provide them the guidance and support, and also grow this community of awareness. So on this World Cancer Day, my clear message is never give up, and continue with your journey with all the positivity and encourage others to succeed. Thank you.
Thank you so much, Amar. Yes.
Now what I want to add, here are two individuals who have led a normal life even during the treatments, and how they have accepted it, and this is the outstanding example of making cancer a chronic disease. You know, we don't say they are cured, you know, even though it has been 8 years, 10 years, but they are normal individuals leading a normal life. I think the most important message for this day is, like I said, you know, fear, how we cannot have fear. Today somebody has diabetes, we don't fear it, we accept it as a part of your life, undergo the treatment, and as we understand this complexity of the disease, as we understand more about the disease, more about personalized medicine, more about treatment, today cancer has become a highly treatable disease. But provided you make sure you identify the stage, identify the pathology of the disease, and treat accordingly. So we are now more into advanced form of therapy in terms of genomics, in the gene expression of these patients, where we look at what is the genetic component, why is it somebody responding and why is somebody not responding, and the person who is not responding, why, and also somebody who is supposed to not respond, why are they responding, and that gives you the information. The most important thing we are today doing in the era of information technology is gather this data, and when the next patient walks through your door and say, I have this kind of an expression, I have this kind of the genomic expression, the pathology, the stage, I know exactly like what to plug in, what kind of treatment to do, because of the data is available. So this is becoming more and more important for us, and that is where, you know, as we walk towards the cancer as a chronic disease or conquering cancer, that has made a huge impact for us in terms of outcome, better outcome. You know, nearly, you know, in advanced cancer, even in India today, you know, we are very proud the cancer care has reached the global standard. When we do our audits to see what is our outcome, recurrence rate, we are equal to the global standard because of this. And thanks to lot of technology, lot of knowledge, and lot of talent, we have revolutionized cancer care, not just in big cities like Bangalore, but even in smaller cities, and creating this accessibility, affordability obviously. Now these are some of the things which have happened in the last 8 years, which has really changed the way we look at cancer patients, or way the patients themselves look at it, and the outcomes. So we have so many history of patients who are doing very good, and lot of times people were afraid to come out and talk. Now we have people talking and forming this pink hopes, which is again another revolution, and that really has made a very big and positive impact on how we look at the disease.
Absolutely, as Amar rightly said, that it's not a disease, it's an experience.
Yes.
Fantastic.
Absolutely.
Thank you so much, Vandana and Amar, for joining us and helping us inspire everyone who is watching us today. As we have promised, it's now time to ask Dr. Rajay Kumar, Vandana and Amar questions that you would want answers of. We will have live questions coming through which we would want your answers.
Sure.
Looking forward to. Yeah.
Okay.
So let's have our first question. Is cancer hereditary? If that is the case, is that early measures which can be taken?
Yeah. Cancer is really not hereditary, we can't use the word. We can say there is a familial, because there may be a genetic predisposition to developing some cancer. The outstanding example we know very well is breast cancer. If somebody has breast cancer today, among their offspring, daughters, we can identify a particular gene to see whether they are likely to develop the breast cancer, or if the mother has that particular gene, it can be transmitted to the daughter. And having done this, there has been some people who have taken radical approach in terms of having their breasts removed, reconstruction done, but we believe more of an approach where if we identify a patient who has this positive gene, close follow up, identify if the disease comes back. We don't know exactly at what age it is going to come. If it does come, we can identify at that time and relatively take a measure which is very conservative in terms of lumpectomy, and really go for a cure. So that is the measure we believe in, but in the world today globally, people have taken radical approaches. So we have to, jury is still out on what is the right approach. From our viewpoint, right approach is close counseling followed by follow up, and identify the disease at an early stage should be the answer.
So is there something which you want to tell probably all the young women who are watching today?
Yeah, if you have a family history of breast cancer, obviously it is a concern. Usually it could be a mother or a grandmother. There is a thing called skipped also generation. So it is very important to undergo this kind of genetic testing at a particular age, usually after 30 years, 25, 30 years, and we then identify if there is BRCA positive or not. If it is positive, obviously close follow up has to be done. If it is not positive, it can be regular follow up, and we don't have to really do that close follow up.
Let's go on to our next question. And the question is, does the use of non-stick cookware cause cancer? Is Teflon in them harmful in any way? If so, how much non-stick cookware is okay to use, and how can we repeat?
As far as the knowledge goes, Teflon is very hard to say it's harmful. We believe any herbicide, pesticides, any chemical could be carcinogenic, but we cannot prove this. There is no actual evidence to say it is carcinogenic. The problem in cancer and carcinogenicity is very complex, because it takes decades to prove if something is carcinogenic or not. When I did a research on the Agent Orange from Vietnam veterans, the government there was not giving them compensation, even though there was a significant increase of cancer from Agent Orange exposure during the Vietnam days. This is a spray. But actually we have to go to the people who have died on autopsy and look at the level of dioxin level. And their high level, ultimately that proved it was carcinogenic. So it's a long road to prove it is carcinogenic or not, but we believe anything which is, as a chemical which has certain categories which may make it carcinogenic, one has to be careful. But in this particular instance, it is hard to say whether Teflon is carcinogenic.
So people can still use non-stick
we have to probably do more research and more look at it.
Yeah.
Ultimately, if you want to really prove, you have to animal testing,
problem with animal testing, we have to use very high doses, and that is not what we experience. So it gives a confusion status,
Correct. I've heard it from a lot of people. I don't know if it's true or just rumors. Will you please explain?
Yeah, the processed food, yes, one is always concerned about some kind of a processed food, exposure to herbicides, pesticides, what are the preservatives we use. Anything like that can obviously alter your body cells to cause cancer. When you look at it, what is cancer? Cancer is really interference in the death of a normal cell. So normally a cell has to die after a particular period. It performs its function and dies. It is like a retirement and death, But in cancer, that kind of a feedback is broken down, where the cell is told to die. Doesn't happen, because it becomes a rogue cell, and because it is rogue cell, it continues to multiply with no control and starts occupying space. To understand. So, for example, any kind of stimulation, any kind of irritation can trigger. But all the people who have this irritation will not get cancer. Why? Because there is a genetic predisposition. There are certain people who are genetically predisposed who get this cancer. So when they are exposed to this. So even when you look at processed food or smoking, all smokers don't get cancer. But there is a higher incidence, because when somebody is genetically predisposed or has undergone a mutation, they perform normally if you don't smoke. But the smoking causes a certain, constant smoking, you are talking about decades of smoking, causes a certain change in this cell, whereby this mechanism is broken down and they continue to multiply. So this is what causes cancer. So some of these agents certainly can be carcinogenic, and again, to 100% prove it's a long road.
Totally.
But what evidence has shown is people who are exposed to these long-term chemicals have, when you do a randomized trial, have higher incidence of cancer.
Okay. So you mean to say processed food definitely should be avoided?
Avoided, yeah. If possible, you should avoid. That's
okay. Now let's have another question. Does using sunscreen really help prevent skin cancer? If yes, what should be the SPF number of cream?
Yeah, I am not sure about the SPF number of the cream. All I can say is sunscreen does help to prevent cancer, but it may not be relevant for Indian population because of our skin color and the type of cells. We are somewhat protected, whereas in the Caucasian population, it does prevent a disease, skin cancer called melanoma, malignant melanoma, which is very aggressive disease, and also it causes basal cell cancer, certain types of skin cancer, which is very common in Caucasians. In the Indian population, we don't see that much because there is a protective mechanism, fortunately.
Fantastic. Okay. Now let's move on to a few questions for survivors. We have these questions which have come from Mumbai, and this is from a male who is aged 35 years. My dad is suffering from third stage lung cancer. He has a mast cell in the left upper lobe. The cancer is not spread. Currently he is taking chemo and radiation treatment. The doctor said that there is a cure for cancer where the medicine costs more than $1 lakh. So what do you have to say about it? Had you had to face such issues?
Let me take that. Yes, during the radiation, we do combine the cycles of chemo, and from my experience, I went through Monday to Friday radiation, and in between there is also a chemo cycle, and they gave a weekend off. Saturday, Sunday, no radiation, no chemo, nothing, go back home, and then come back from Monday to Friday again. So it does, and yes, it is expensive from a medicine perspective. So 10 years ago it wasn't that very expensive, but today, yes. So answer is yes, we will go through.
Yeah, but what I want to add here is this gentleman has said the cancer is localized and is stage 3.
Yeah.
So we don't know what is this drug which is 1 lakh needed at this point. It is not a metastatic cancer. If it is localized, my suggestion would be to complete the planned chemo radiation and do a close follow-up. I do not understand, based on the report he has given, why there needs to be continuation of care. close follow, like the Amar said, close follow up is all needed, and we don't understand what is this 1 lakh, because there are biological therapy, or we have immunotherapy now, but they are all for more advanced diseases when it is not localized. So this may not require this kind of.
You also say that it depends on the weight of the patient.
Yeah, that is the body surface area.
Okay.
Whenever we give a certain dose, we check the height and weight, and accordingly the dose is made. So something which costs in the package, say for 5 milligrams, let us say it is 50,000, the person may require actually 7.5 milligrams.
Okay.
It requires more.
Okay.
So that is why the body weight. Okay.
Okay. Let's have our next question again, going out to our survivors. My dad is currently undergoing chemotherapy. How can I help him, in pain relief for each of the sessions he undergoes?
Well, yes, chemotherapy, you do have the side effects, of course, because, before that the doctor briefs you, in fact, saying that these are the side effects of that. First is the nausea, and then, well, of course, along with that, the doctor does give you the medicines to subside the nausea. The nausea lasts for about 4 or 5 days. In fact, the medical treatment is now so much advanced that even now that period is reduced. It comes down to about just 2 or 3 days. After that, it stabilizes. So you're back to normal, not normal exactly, but you start getting a little better. In fact, even after that, you're able to eat some food and all that. So before chemo, during the chemo, it's very difficult. After the chemo, a few days after that, you get stabilized. So this thing, pain, regarding pain, there is no pain as such in chemo. Not actually, it's the nausea which is more this thing. So you don't feel like eating food, and because of that, you feel weak and drained and all that. That's all. But yes, after 4 chemos are over, the next medication which takes place, you have a lot of leg pain, I would say, because that is what I had, say, the leg pain.
But that depends on the type of drug.
Type of drug, exactly. So I wouldn't put it as painful.
Okay.
So one point to make, one of the things which I used very effectively was to continue with my work, continue with all other hobbies, so distraction of the mind is important. Pain is in the mind.
Exactly, it's all here.
It's all here.
It's all here.
Okay.
I think, like I said, in my 40 years of practice, when I see my first patient of the day, who is going to have problems with drugs, who is not going to have. Counseled. See, counseling is very important. That is why, we have even psycho-oncology departments where patient has to be counseled before the therapy properly. If they are properly counseled and addressed, they understand the situation, there are far less side effects. In fact, majority of the patients for chemotherapy are outpatients. They come in the morning, take treatment and go. Some of them, like one Amar and all, they do their work on computer while taking treatment. So it becomes acceptable. But if it is not well prepared, and the family plays an important role.
Yes.
So the important thing to understand here is what is the level of support the family is giving.
Right.
If the family is positive, the patient looks to the family for support. If the family is positive, the chances are they become positive. If the family is negative, I get patients with families who are more negative than the patient.
Absolutely.
And when that happens, it's a disaster. Because they've already made up their
through
mind.
so much.
Yeah. So family have to be totally supportive, whether it is husband to the wife or the wife to the husband, and more important, children to the parents. Very important to be positive, and this makes a huge difference.
Like an example, I just wanted to be at home, and not meet people and friends too much. So my husband told me, I think it's time that we went out for a drive and let's go and have a burger. I was surprised. I said, why should I have a burger? I'm supposed to be on health food, So he says, well, let's drive down, let's go down to Brigade Road. I'm going to have a burger. You make something for yourself at home. So he got me a bun. I made a tikki, put it in that. We sat in the car at Brigade Road. He had from McDonald's and I had the home food. So it is health as well as the sick. So that's the way it should be, Get going.
Fantastic. I'm sure they will learn a lot after listening to you people. My next question is to you, Doctor. On a routine checkup on my behest, she got a pap smear test and a small biopsy done. Post it because of the doctor felt it's a lump. The reports had a negative cervical screening test and then a positive biopsy which showed mild dysplasia.
Yeah.
Okay.
Yeah.
So which of the two tests, are they different from each other and which
Yeah.
is right?
Yes, screening test is, as the name says, it is a screening test. It shows only something which is, abnormal, but screening test is not equivalent to biopsy. Because if the doctor felt a lump, obviously biopsy is the answer. The screening test is a very early thing to say if there is any like a dysplasia, something suspicious you are seeing. So the biopsy is the right approach and biopsy gives you the right answer.
Okay. So has the right procedure been followed?
Yeah, the biopsy has been done. What we need to look at is mild dysplasia. We need to go deep into this. Mild dysplasia also doesn't mean it is cancer. So we have to see if there is any precancerous kind of change, or is it something which we can just follow. What we do normally if there is a dysplasia is to just do a cone biopsy and remove that area and not do anything and do a close follow-up, because dysplasia is not really a cancer, but it could be some form of precancerous situation which you can totally take care of by doing a total biopsy of that area.
Okay. Our next question again goes out to you, sir. How can we diagnose liver cancer in an early stage? What are the symptoms and how can hepatitis B infection cause cancer?
See, hepatitis B infection is one of those which is chronic. Hepatitis B is known to cause liver cancer called hepatocellular carcinoma. It is not that all people with hepatitis B develop. There is of course a vaccination to prevent hepatitis B. But once they get the disease, today we have certain targeted treatments to do that therapy. It can control the hepatitis B, but unfortunately their risk of developing hepatocellular carcinoma is high. The only way you can do that is to do a blood test called alpha fetoprotein. That particular blood test can tell you if there is cancer coming in this particular individual. We can also do like normal ultrasound the liver, or in people who suspect you can even do scans, but we normally advocate doing this blood test once in 6 months or a year and monitor this patient. But I have seen myself in my own practice significant number of people with hepatitis B with a history even years ago, 10, 20 years ago, developing cancer. This is something which has to be monitored lifetime. But there are various treatments. If you do have liver hepatitis leading to hepatocellular cancer, you have to detect it early. Early detection has significant number of treatments which can be even curative. Sometimes we go as radical as even doing liver transplant, provided the disease does not spread outside liver. So if it is confined to liver, you can remove that part of liver. See, the good thing about liver is the liver grows. What a lot of people don't realize is if you remove part of the liver actually grows back to normal. So we don't have to be worried, we can remove one part of the liver and let the other part grow. And we actually do a procedure called ALK procedure, where if the particular part of the liver is diseased, before we remove that, we let the normal part of the liver grow by doing changes in the blood supply, and once it grows, we go and remove the abnormal part. So technology has advanced so much, it is a treatable disease, but what we don't want to happen is for it to spread outside the liver.
Correct. Okay, we have another question for you. This is again coming out from somebody from Mumbai. My mother, aged 54 years, was diagnosed with a colon cancer and surgery of colon was done on 1st December. The biopsy report post-surgery showed there's a disease again poorly differentiated and lymph nodes. The surgery team referred her to radiology section for chemotherapy as a precautionary measure. We do not want to get her chemotherapy done. So what do we do?
See, the important thing here is what you don't want and what you have to do are two different things. So the important thing here is when a patient comes to me and says this is what we like to do, I tell them you come to me for an opinion and what we think is the right thing. So you come to me for an expert, you already made up your mind what you want to do, what can we do. So this is a protocol where a certain treatment has to be done. And the issue is there any alternate therapies, not proven. So they have to undergo a protocol because they have positive notes, and if they have done a PET scan, I would advise them to do a PET scan. If the PET scan shows only nodes, nothing in the liver, they do need a chemotherapy for a fixed period of time. So I would think they were referred to for medical oncology department, not radiology. I think they must have referred to medical oncology because radiology, radiation becomes radiation therapy. So the medical oncologist here has recommended chemotherapy, rightly so. But there are some markers we do, it's 54 years, we do certain markers like KRAS and BRAS, there are certain other things. Based on that you can actually predict how aggressive this tumor is. And based on that you can actually, if you want to modify some therapy, you can. But that is the era of personalized medicine. But routine treatment requires a chemotherapy program for about 6 months.
So there is no way they can
Absolutely, I think there is no way where you can avoid the chemo.
Because the problem is, when you avoid these things, the risk is, it
High.
comes under high risk for
High
disease
risk.
spreading to the liver. So the liver, once it spreads to the liver, it becomes more of a control rather than a definitive treatment. So colon cancer is notorious for spreading to liver and lung. So we have to, we assume when it has gone to the nodes, why does this person require chemotherapy? When it has gone to the nodes, we think it is broken a defense barrier of the body. So the lymph nodes is an expression that it is systemic disease. Even if all the scans are normal. Because it is systemic disease and because you have less number of cancer cells, the chemotherapy will be more effective now. Because you cannot, if you have to kill billions of cancer cells, I can't give 1 billion times more chemotherapy, I'll kill the patient. So the chemotherapy dose is limited. So when I deliver this, I have a better chance of killing less number of cells rather than wait for it to become large number of cells and try to do. So earlier the better in this particular case. That's why it's called adjuvant therapy. That means you give it even when there is no visible disease in the body, because we assume there is microscopic disease because it has broken the defense barrier.
Okay. Another question coming out to you people. How to manage pain in stage 4 cancer patient? My friend is suffering but he refuses treatment and surgery. How can we make him more comfortable?
Well, first of all, I think if he is advised surgery, then he has to go in with the surgery. There's no way where you can avoid all this. Alternative treatments, I don't much believe in that, because there should be a proof of what? I mean, I take this and I get all right. I should have a proof. But here with this sort of allopathy medicine, I have proof that I'm going to take this and I'm going to be fine. Well, that's one thing. And pain, yes, of course, there is pain which you have to bear that, the limited amount of pain that you're going to get. But then again, as we said, it all depends upon the person and it all depends upon here in your mind. So you take it up as the thing, accept it that you have the problem, accept it that you're going to be fine, go ahead with it, and then say, yes, I'm back into my road, I'm back. It's just a bend in the road. You're going to walk further. So,
regarding the pain, a lot of things have been written in cancer care for pain control management. We have, morphine to hospice. I just like to give one example. In pain management, in oncology, very important to identify where the pain is coming and how. It could be, you don't get pain all over the body in cancer. It is because the cancer is irritating a particular nerve, particular bone, it could be causing pain. So once you identify where, you can actually give directed treatment to that. For example, you can do radiation, we do even sometimes high-end radiosurgery, or block, you can do a block in that area. So by blocking that nerve area, you can relieve the pain. You don't have to necessarily give morphine and other things for all pain disease. So you have to describe the pain properly, identify based on scans, PET scan, where the pain is coming from and why it is coming. Once you identify, you can treat the cause. Even in advanced cases, you can treat the cause and get rid of pain. So the pain management, what it was years ago and now is totally different. We see patients, I myself saw a patient coming from different parts of the country where the patient was in a wheelchair on morphine. When we did the scan and identified it was coming from the backbone. So all we did was treat that area, and literally after a few weeks patient walked out of the hospital with no pain, with no morphine. So these are things that are definitely possible. The doctor has to spend enough time, unfortunately, doing it, identifying. It cannot be 15 minutes prescription. The patient and the family have to cooperate and understands. If it can be done, it is definitely a treatable disease. That is the reason we stay away from using certain terminologies like you are in hospice care, you are in victim of cancer, you need palliative care. These are all treatments terminologies used long time ago before we understood the disease. Right. Today hospice care can be for anything. Anybody who is in the last stage, diabetes, blood pressure, cardiac, all can be in hospice. It is not related to cancer alone. So cancer is today properly done is treatable, and even pain is highly manageable if you treat the cause. The most important thing is to identify the source of pain and treat.
I think with the cancer treatment, people have gone to the doctor so many times, they've got so many treatments done that they prefer bearing pain instead of again going to the doctor and telling them that this is the pain which we have. Is that something which you normally face?
Yeah, but when it comes to pain, I think majority of the patients want relief, because nobody wants to suffer. Even the families cannot see their loved ones suffer. So pain is one area where everybody seeks advice, everybody seeks a solution for that. And I think there are, in my view, I like to take a complex situation and simplify. I call it simplicity in complexity. So when you look at it, it is a complex situation, but how do you simplify? Where is the pain? This is the pain. Treat that, the pain can go away. It may be as simple as that. And as you get more experienced in oncology, you begin to realize it is very simple. It's not that complicated. It sounds like hey, is it possible? It's possible. So, but you have to make sure you go in a logical way.
Fantastic. Okay, let's have another question for you now, sir. My elder sister is studying her final year PG anesthesia and was recently diagnosed with the Hodgkin's lymphoma stage 2A. We have not seen any symptoms till date.
Yeah. I think observe that small lump. So Hodgkin's disease is lymphoma. It is a particular disease which is caused by a virus called Epstein-Barr virus. And it again takes long time for it to show up. It is a highly treatable disease, and one of the rare times we use curable. And based on this particular stage 2A, it is potentially curable. If properly treated, I would say 90% in our own practices, we see 90% will be disease free for 10 years or longer. So this is a condition where it may require chemotherapy, it may require localized radiation, but usually chemotherapy is the main treatment. There are protocols. Under the protocols is treated, they go into complete remission. And the main symptoms they can present with would be mostly like fever, pleuritis, means the irritation of the sketchiness of the skin. These are the main symptoms. But again, it is highly treatable. I would strongly advise they undergo proper treatment because potentially curable.
Okay.
I don't think we should wait till it becomes.
She's got side effects of, like nausea, constipation, ragging.
I think this needs to be evaluated, because where the disease is localized, if it is localized in the stomach area or in the lymph nodes, that could be causing some of these problems. So a PET scan is what we normally do, and the PET scan gives you the proper staging and the proper biopsy based on the proper treatment should give a very good outcome.
Okay. We have another question which has come. My father, 67-year-old, was diagnosed with prostate cancer a year ago. Initially, PSA value was more than 150. After removing the testis, it came down to 1 to 2. It's remaining at the same value from the past 1 year. He is a metastatic patient. I would like to know if whether this PSA value would remain at the same in future.
Yeah, that's a good question. I think normally in these situations we just go by PSA. There is also a test called PSMA we do, which is bone scan, like a newer bone scan test specific to prostate. But PSA follow-up, if the availability of PSMA is there, you can do it once in 6 months, and this will tell you exactly if the disease is recurring or not. Usually with test is removed, we don't do that nowadays. It is some urologists still practice, but nowadays we put them on hormone therapy where the disease is, we look at it. But with this normally 18 months to 2 years they do very well. Around 2 years to 2.5 years some patients break out of it. So at that point they have to undergo other forms of therapy. But PSA is a good measure to do it, definitely.
Okay. So let's have our next question. Can you suggest a diet to be followed by a cancer patient? Also precautions to be taken by cancer patients in food and diet? I think Vandana, you should be able to tell us better.
Food, yes, of course, plays a major part. You have to eat healthy food, what I say. And, avoid food which has a lot of these pesticides. Like, to tell you frankly, I would go into more of organic food, that is freely available nowadays. And then avoid fried food, the common things, as we say, fatty food, be on a healthy diet, and then more of fruits, and as they say, more colored vegetables, also colored fruits and vegetables. Among them I could say pomegranate is a very good healthy food or a juice that you could take. And then simple things like amla, the gooseberries as we say, that is a very healthy thing. Wheatgrass, for example, that is very healthy. And I think Amar can tell.
So let me add a few to what you already said. It's very important to have a good balanced diet. Basically, when you're going through chemo, there is going to be a lot of weight loss and weakness which will fill in. So myself had a lot of badam, by some kind of a preparation. Mom prepared at the time, and especially in my case being a tongue cancer, you couldn't take many things orally. Everything was through the tube, and so we had to look at the liquid diet and then take at the same time, face the whole challenge of going through the treatment. So and as Vandana said, it's important that we have a fruit diet, but take off the skin, peel off the skin, and then have almost all the fruits can be had, and colored vegetables will help in having the vitamin content. I would also advise, suggest all pulses that have a lot of vitamins, and that is gives the nutrition diet that is required to face this. So you should eat all.
So are there a few favorites which you probably had to sacrifice?
As I said, for my situation I couldn't eat through the mouth, so everything had to be in the form of a liquid at that stage doing. But as a sugar patient I had to also forgo all my sweet stuff, so nothing was there. During the surgery I was on insulin, so absolutely some of those food had to be avoided. So otherwise it's fine.
Now, one of the things is, diet has been written up a lot in cancer. Any bookstore, anywhere you find a lot of things. There are a lot of proponents of various diet. But one thing which is definitely proven is obesity is one of the major causes of cancer. Very clear. So, obese patient, lifestyle change, breast cancer, for example, in India is growing rapidly in the middle class, upper middle class. In Western countries, it is very much there, 1 in 7, 1 in 9 women, because of dietary habits. So diet, there is no doubt, plays an important role. What is a remedy? Only thing is people take antioxidants, that, various things have been written up. The simple remedy is low fat diet for somebody who has got a history of cancer in the family, or somebody who has a breast cancer or similar diseases. Low fat diet is the most important thing that can actually prevent cancer from coming back for a longer period of time. I think this is one thing simple to follow. That doesn't mean you can't go out and eat dosa or some fried food. You have to limit number of times you eat. I think that is what we are looking at. You don't have to sacrifice and give up everything. Limit it. Be conscious of it. Be aware of it.
I think that should essentially form part of anybody's lifestyle.
Absolutely right. That's right. I mean, this is for even people who don't want to get cancer.
Absolutely.
And good healthy lifestyle, like if you eat something, you go and jog or walk for a few miles to make up for it.
Correct.
So it is eventually boils down to then there are a lot of new things coming. For example, statins, which is used for bringing down cholesterol. we think can play a major role in reducing cancer. Metformin, which is one of the drugs used for diabetes, is now becoming another drug used for patients. We have a trial, ongoing trial for our patients with breast cancer where we are using metformin in addition to regular treatment to see how this cancer may not come back. So a lot of things are going on which are related to diet and certain preventive ways to prevent cancer. Okay.
Absolutely. Okay. Another question for you, sir. How do you get yourself accurately diagnosed with cancer? Is there a self-exam? Can you demonstrate or guide how to check for different cancers?
I think this is a age-old thing. We always say detect early, we say, but it depends on the detection in the location. For example, head and neck cancer or a breast cancer, technically by self-examination, or if you have a soreness in the mouth, early examination by your dentist, or early examination can detect early, provided if you have someone like a smoker or a person who chews tobacco. Very important to undergo a yearly checkup with a dentist to see our head and neck surgeon, ENT doctor. As far as breast cancer is concerned, the most conventional way is to do self-examination of breast. Can you find a lump on when you take a bath or something? If you examine once in 15 days, once a month after the age of 30 years or so, if you find something which was not there, obviously you become alert and go for the doctor. Recently I had a patient who had a stomach lymphoma 10 years ago. Then she was examined herself and found a small lump early stage. So obviously she was aware of it. So this is how we have a lot of brochures, things to see how to examine yourself with the fingers. All of this can be obviously told, and this is part of the preventive aspects. Do they need to get tests? Yes, there are recommendations after the age of 40 to undergo mammography, ultrasound. Fear is X-ray exposure, but we believe that is not really any exposure to it. Nowadays most of the X-ray equipment, mammography have very low radiation. So I think done in a proper way there should not be any harmful effect. Ultrasound is one. There are various advanced types of ultrasound we actually use, what we call as volumetric analysis. By this you can very detect early even if there is changes taking place in a pre-cancerous condition. So these are the tests which somebody can undergo after the age of 40. For example, in advanced countries the norm is the insurance coverage doesn't happen unless they undergo this kind of preventive checkup once a year. It is mandatory, and most of the people think of going on a birthday. That is how you remember. It is my birthday, I have to undergo the test. But that could be something people can follow. So whenever the birthday comes, some other things, I not only celebrate but also get a test done. So these are simple ways of doing it.
Correct. Okay. We have another question again. My 5-year-old son was diagnosed with an embryoral middle ear
rhabdomyosarcoma
in June. And he's undergoing VAC chemotherapy as per IRSG protocol. So what do you have to say about
The standard protocol include total cycle 14 cycles. We are done with 11. The tumor reduced since diagnosis. Does he have any way to identify the remaining? Yeah, I think the important thing here for his father to understand is he has to take the child through the protocol 14. There is no way of compromising on that. So you have to conclude the protocol, then wait for nearly 6 to 8 weeks, then get a scan done to see whether the disease is completely gone, it's got complete remission. But I would not stop at 11 just because the disease is reduced and rebiopsy at this time. No, I don't think that is the right practice. Complete the protocol. There is a reason there is a 14 protocols. It has to be done, following which you wait for 2 months or 3 months as recommended by your oncologist, and then get a scan to see whether there is any residual disease. If there is residual disease, what can be done should be decided at that point.
Okay. We have another question coming up. I underwent a squamous cell carcinoma surgery on my tongue.
Amar.
Yeah.
Okay.
My taste buds are absolutely zapped after the radiation. I was wondering if my taste buds will be back to normal. And do all taste buds come back, or some are just left out?
Yeah, so some are left out, but it will come back. It will come back. I must admit that the tongue, an organ which is a marvelous creation of God. It is it's not something I don't think man can recreate stuff. Post surgery, my first meal, I remember after 2 months of the tube, and the tube was removed off, I was so eager to have something through the mouth. And they had those chickpeas and some of those grams and all that. They said that's the healthy diet you have to take. And so I put it in my mouth, and I couldn't do anything because the tongue was immobile for all this while. It didn't know how to move food in the mouth. So I had to take it out, and then I realized there's a bigger challenge now. I got to start from fresh, tongue exercise, and then get that taste and everything. It all come back, but it takes time. So starting from speech, and sucking, all that stuff has to be done from scratch. It's almost like a child to start off with. Right? I was not able to pronounce well. Started using a choice of words, different choice of words to learn, and then go through. So answer, yes, the taste will come back. So after that, you can see things back to normal, and you will have a different type of movement of your tongue. Sometimes I was biting my tongue so horribly because it used to get in between the teeth. As I said, it's a marvelous creation. It just in a split second puts the food in between the teeth and comes back. So that's something as an experience that you will undergo, and once that's out of that, you will be all right.
I think after all this has happened, we have started to appreciate our organs a little more.
Absolutely, yes.
But how long did it take, Amar, to come back?
I think my full speech came back only after a year. I had a lot of slur in my voice and speech, and there's a lot of yoga therapy and also the movement of the tongue, because my lower portion of the tongue had to be cut off, and so that is from where a lot of other pronunciations happen. So today I carefully avoid those words.
Okay. Another question which we have for Amar and Vandana, both of you, how important it is for our kid to know the cancer he's suffering from. As parents and family members, we have been going through extreme pain when we see our kid suffering through the pain during the diagnosis and the treatment, and sometimes side effects due to chemotherapy. So does the child know everything, or he should be knowing only limited stuff as to what's happening with him?
Well, I think this depends upon how old he is
6
to
years.
understand.
Yeah, 6 years.
6
okay,
years.
the female is 6 years.
6 years. I mean, I think a child of 6 years will definitely go and Google it out and find out what cancer is. Because, we at CG have formed a group where we have this COP support group, and we have a lot of children. We do counsel the parents, the parents need counseling instead of the children. Because the children are happy. I mean, you don't have to go too much into detail, but tell them, yes, you're going to be fine and all that. But it is here the parents who need the counseling. And when we talk to them, because they see the child suffering and they are not able to take that. So I think a child will Google it out, but if you tell them that you're going to be fine and everything, that's
And
okay.
even for a doctor, for me, it's very important that the child know to some extent what's going on. That way they cooperate better. So you can really make that connection with the child. Otherwise, the child will be negative in tears. Why is doctor?
Correct.
So I think it's important to create that bondage, and for that bondage to happen, the link to happen between the doctor, nurse, and the child, the parents have to cooperate, and we don't have to give the extreme seriousness,
Probably
but we
limited
have to
information.
limited information in a way, like they said, in a fairy tale manner. They should communicate, so they become positive. They see a bright side of it, then they cooperate. I think even the parents actually looks like here they're undergoing a lot of pain. They require counseling. They should see a psycho-oncologist, get counseling. That will help them to deal with the child.
Okay. We have another question for you, sir. Is stem cell therapy effective in treating leukemia? I read that there's a high risk of infection and a possible chance of the donor cells attacking body.
See, stem cell therapy is not a treatment for leukemia as such. Leukemia has got a protocol treatment with drugs, chemotherapy and all. When you do the bone marrow transplant, sometimes we use certain stem cells for the leukemia to make the bone marrow recover fast. And this is what is done by the bone marrow specialists. but it is a treatment where it makes the recovery of the bone marrow quickly. So that is where we use certain stem cells called mesenchymal cells and all, but routine stem cell therapy is not practiced except in a very limited way when they undergo bone marrow transplant. That is when it is used. So stem cell itself causing infection and all should not be a problem. Done properly should.
So that's all right.
Yeah.
Okay. Is blood cancer transmissible
Yeah.
by blood transfusion or any other way? If you could explain.
I think majority of the blood cancer is not transmitted. There is certain viral type which is documented, which can be, but it is a very small percentage of patients. Majority times if there is a leukemia patient, I take their leukemia cells and give it to me, I will not get. The explanation, I normally like to give is body defense mechanism is such, it shuts off. It is not a transmittable disease majority time. Body will kill those cells quickly because our body is not ready to develop leukemia, so it will. So it is not a transmissible, I would say 99% of the time, but there is one condition under leukemia which is viral, and if that virus goes into your body, you may develop, because it's an infection, you may develop leukemia.
Okay. We have another question for you, sir. What is the difference between radiation therapy and chemotherapy, and which is more effective, less painful?
See, radiation, all these are different treatment. Like in cancer care, we have surgery, radiation, chemotherapy. Radiation is using gamma radiation to the specific area where you want to kill cancer cells in that local area. It is not a systemic treatment, it does not go through the whole body. So when you have a limited disease, when you have a large tumor or want to make sure that particular area cancer will not grow, we use radiation to that area. So the side effects are limited pertaining to the area of radiation. Today we use very highly advanced form of radiation, what we call as IMRT, IGRT, radiosurgery. Because of that, the side effects from radiation have significantly come down. Why does side effects happen? Because we treat normal tissue also, we used to. Now we don't treat, in advanced centers we don't treat normal tissue. We just focus on the area of interest, so we don't get side effects, minimal. Whereas chemotherapy is through the whole body. It goes and attacks all the cancer cells. In answer to the question of which is more effective, there is a time and place for both. Normally 60% of the patients of any cancer patients get both chemotherapy and radiation in their life cycle. So it is both are complementary to each other in majority of the time. There is a place to give chemo and there is a place to do radiation. So the side effects varies. Chemotherapy, as we discussed already, historically is supposed to have more side effects, but it has decreased dramatically now with various measures we take. And less painful, obviously, both are not painful, we discussed that already. None of them can cause pain, right?
Absolutely.
Okay. The next question coming up is from Delhi, from a male of 21 years old. In March 2015, I was diagnosed with cancer, and the cancer is synovial sarcoma stage 2. He wants to know what is the chance of survival and the reoccurrence or the metastasis.
Yeah, I think here patient has, it all depends on the type of treatment the patient has taken. So the patient has undergone an amputation also, and they advised chemotherapy, but they did not undergo chemotherapy. Important part to remember that they are just on follow-up and they are doing good now. 1 year now, 1.5 years, they are doing good. So the question is, as per my doctors in supporting the journey, willpower very important, positive attitude very important.
He's taking some
Ayurveda treatment. I can't comment on that, but what I would like to say is, stage 2, if chemotherapy was recommended, we have to look at the exact pathology. RBCI is a good center in Delhi. So if they have seen a sarcoma specialist, I would certainly advise they see a sarcoma oncologist who specialized in that, get an opinion. If sometimes because of the time already went by, don't recommend chemotherapy now, close follow-up at this point. but full understanding maybe at high risk recurrence. Usually it attacks the lungs. Lung is where the disease comes.
So they should immediately probably meet.
Yeah, I would suggest that.
Next question has come from Bangalore from a male of 58 years. I had oral cancer in the floor of my mouth due to betel nut chewing, and left side of jaw was replaced by grafting fibula. Radiation, 30 stings, and adjuvant chemotherapy sessions
Yeah.
have been done 3 months post surgery. Regular CT scans show no recurrence since last 41 months.
Yeah.
No smoking, drinking,
Yeah.
pan chewing since surgery. What are the chances of recurrence?
Since the disease has not come back 41 months, it's very good. The chance of the recurrence in the same area is much less now. Because usually this kind of cancer tends to occur within 2 years. So it's past the 2 years, the prognosis is good. But because of the history of chewing and tobacco, he is again a candidate for developing second primary. So he needs a constant follow-up from his dermatologist to make sure nothing known like an oral small ulcer is coming back in some other place in the oral cavity. Otherwise his prognosis is good. Potentially he may be cured.
Okay. Is there any link between multiple lipoma and cancer? And is there any way to get rid of lipoma and making sure that it
Yeah.
doesn't spread further?
Majority of the time, I would say 99%, there is no link. There is small evidence, some evidence that certain types of lipomas can lead to liposarcoma. But really there is no need to get rid of them. Because a lot of times the lipomas are multicentric. There are various parts of the body. And I myself have lipomas in parts of the body. For the last 20 years I have not removed them. So I don't think it is going to develop into malignancy except for the small 1% incidence or so.
Okay. Is there any kind of test which probably should be
No,
done?
just follow up if the lipoma is growing. In that case I think you can consider getting it removed in a particular part where it is growing. Otherwise you don't have to go and be anxious about getting it out. Unless it is causing trouble for you, pain or infection or anything.
Okay. So if you could just have some.
Yeah, thanks.
So let's talk to Vandana till
Yeah.
then. What is the daily activity, lifestyle modification that needs, that you probably need to cope up with cancer?
First of all, you should be back to your routine. That is, even during, as Amar said, even during chemotherapy and radiation, he was back with his laptop and everything. So even for us, whether it's at home or whether it's in your office, your workplace, you need to get back to your work, because that's the way you're going to be diverted. Your mind is going to be diverted. Otherwise, if you sit idle, as they say, you know, devil's workshop. Idle mind is the devil's workshop. So if you're sitting idle, the only thing is you're going to be thinking of
that.
my next chemo, what's going to happen to me, what are the side effects. Oh yes, doctor had told me that you're going to have nausea. You may have nausea. And even if I don't have, I will develop that. So best is to avoid it, best is to keep yourself occupied. That's the way, isn't it, Aman?
Yes, absolutely. I think as I mentioned earlier, it's a new life. So you could start on some hobbies. You know, my advice to many of the people has been things lie latent and you always didn't find the time to do it. Now is perhaps the time to start a new leaf in your life and move forward with those. Very importantly, I think we should create that awareness, much more awareness about this, both from a diagnosis, from prevention, from what happens in treatment, to what it is to be living a normal life after that. So this awareness should be spread. So my suggestion to them is to spend your time in, you know, in that area to help others succeed.
Okay. Next, let's have another question. My mother, aged 52, was diagnosed breast cancer in 2004. She had undergone lumpectomy and auxiliary lymph node clearance, followed by chemotherapy and radiation. In November 2013, she was again diagnosed with metastatic breast cancer. She's undergoing a chemotherapy that includes Herceptin and an oral tablet of Latrazole, and till date, more than 24 cycles of Herceptin has been given to her. What are the chances?
I think if she is in remission now, that is what I would take it, but she is in remission. How long Herceptin taken? I think 2 years she has taken. In our opinion, what we practice in our multidisciplinary clinic, that is sufficient dose of Herceptin. It can be stopped, or sometimes depending on where the location of the tumor was, how extent, sometimes we give Herceptin only for few more courses, but it can be stopped. In answer to your question on operable, once it is metastatic, it can never be operable technically, but operation may require for a focused area or localized radiation. Chances of survival, it depends on where the stage 4 was. Is it liver, brain or bone? Because bone from breast cancer can survive for a long time, 10-15 years, whereas liver it may not be so. So one has to really look at where exactly this disease presented, how extent it was, and is it in complete remission. That can tell us the survival.
Okay, so let's have the last question for the session. I have heard if we use plastic or disposable glasses to drink hot tea or coffee, it leads to cancer. Is it true?
No, there is no really evidence. Plastic or disposable gives, we don't want to use plastic obviously, but I don't think there is any direct link between that and cancer, best of my knowledge. I don't know if you,
have you guys heard anything like that?
What I heard is
Plastics.
plastic,
Yes, you need to avoid
type of
hot.
plastic used and
Definitely.
so on. The other part was some of the disposable glasses have some wax coatings on that.
Yes.
Okay.
So when you have something hot poured, then the wax melts and gets mixed up with this, and I believe that gets stuck, doctor, in the
yeah.
stomach or in the area of intestine, which is not good for us.
Absolutely.
Yeah.
And in fact, there are some things which say that it is food grade plastic, but I think it's better to avoid it and then use, this paper cup that you have.
Correct.
Better to be careful than sorry.
Absolutely. So on any closing remarks which probably you would like to add on?
I think what we heard here and what we talked about based on the type of questions it has come, it is very clear that people are now more open about talking about cancer, understanding the disease. Or what I like to encourage all my patients in the era of information technology, it's important the patient and family do their own research on cancer care. In fact, in our HCG, we encourage that people to link up with various links. There are PubMed and cancer literature is there. So a patient who is well read on cancer, understands the disease, why the treatment is required, will do far better than the patient who is not understanding. So we encourage them to become really knowledgeable about this, awareness, and then when they come for treatment is better. Same time, a lot of preventive measures can be done, which we today are rolling out in almost every few months. We see new things which are coming in cancer prevention, early detection, genomics. So fear should not be there, as I said, and being open about it, discussing with in the social media, everywhere, being part of it will help to really conquer cancer.
Anything which you would like to add on?
Yes, so just to add that, we want to really convert that fear to hope. That's the whole purpose and mission. But one question that never came up on there, but due to time, is, what happens when the doctor pronounces the diagnosis that you have got
Cancer.
so cancer? Because that's the moment of truth where
The anxiety
the
lies.
anxiety, the shattering, you're lost, you're disappointed, and so on. And we all questioned ourselves, why me? I had no habits of any kind to get oral cancer. And so that's where, the whole exercise of the inner strength has to come up to regain that control, because you lose control and then you come back to regaining control. And so my prayer is the power of positive thinking, that positivity is extremely important in this whole treatment. And while very essential that you have this planned treatment, as doctor mentioned, you cannot skip some things here. It is an extremely planned, disciplined treatment that one has to go through in this. But mentally you have to prepare yourself, and that inner strength that you need to muster is extremely important. So you have to be associated with positive, like-minded people who will help you through that journey and then move forward. So that is my takeaway, and also a kind of message to the World Cancer Day, that please do move forward and help others to succeed.
Well, I would say, तुम हंसते रहो, तुम मुस्कुराते रहो, जिंदगी है बस एक गीत गुनगुनाते रहो.
Thank you so much, Vandana, Amar, and Dr. Ajay for joining us. I'm sure the knowledge and experience which all of you have shared would help a lot of them. We had so many questions, which just shows people are so worried, people are so anxious, and a few questions which could not be answered because of lack of time. So we will ensure that at least offline we are able to answer a few of them. Thank you so much once again.
Thank you. Thanks a lot.